Hi, my name is Morgan Chapuis, and this is my video for the Theories and Therapies assignment. I had typed up all my answers to the questions, and I've just printed that off, so that's kind of what I'm going to be referring to throughout the video and kind of as I talk through each of these questions. So here we go. The first question was, without using any nursing theory or professional approach, what are your initial thoughts about this family and this patient and his family? What are some natural biases you had, and are they based on fear? My initial thought upon watching this video about this man and his family was really just sadness. I think you could see so clearly that schizophrenia had taken so much from this family and really robbed this man of such a good portion of his life. As I've never met with an individual with schizophrenia that I know of, there is some part of me that watches this video and just kind of questions the reality of it all, just because the change before and after schizophrenia was just so dramatic. It's hard not to think this is really all involuntary. He has no control over this kind of behavior, even though throughout the video you hear his kids talk about how this is not a choice, it's an illness. I tried to picture myself and how I would react if I met this man in my own life, and I really believe my first instinct would have been to just avoid him. Even if I wasn't made aware of his diagnosis, I do think that reaction would come from fear, simply because of his erratic behavior and his disgruntled appearance. However, if I had known he'd been diagnosed, if I did know he had been diagnosed with schizophrenia, I believe I would have been still fearful, just because of the violence that can occur secondary to this mental illness. It honestly would be very difficult for me at this point in my life to approach this man with an entirely open mind and without apprehension for my own personal safety based on my current understanding of this disease and my own natural biases. The second question asks, utilizing two aspects from the selected nursing theory, how would you approach this individual if they were admitted to your facility for a medical condition? How does understanding aspects of theory change your approach, and how does education change this? So I chose the deliberative nursing process theory, kind of based on the findings and beliefs of Ida Jean Orlando. The two components of this nursing theory that I'm going to expand on are the patient's immediate needs and the idea that every nurse-patient interaction is unique. If I'm focusing on the patient's immediate needs, I would be approaching this patient with the mindset that they are entirely in control of our current interaction and all of our future interactions. It would be their needs, their concerns, and their wishes that would guide my actions rather than my perception of the situation. I believe this mindset would facilitate greater therapeutic communication and provide the tools necessary to build a foundation of trust with the patient at the very beginning of that first interaction. Putting your knowledge and training aside as the nurse and letting the patient serve as the sole compass of their care is truly practicing undiluted patient-centered care. The second aspect of this theory I'm going to discuss is the idea that every nurse-patient interaction is unique. In utilizing this idea, I would be able to approach the patient with greater flexibility and a more open mind. Removing the idea that care can be pre-templated or predetermined would allow my patient to be treated as the entirely unique individual that they are. Understanding that the nurse-patient relationship is dynamic would promote the greatest attention to patient needs throughout the course of the relationship, even if those needs were constantly shifting and changing from one encounter to the next. In terms of schizophrenia, I think this aspect is key, as this illness can already lead to such erratic and unpredictable behavior. Recognizing that the concerns of the patient 5 minutes ago may not be the concerns of the patient now is critical to providing patient-centered, holistic care that addresses each and every need the patient may have. The role of education in caring for an individual with mental illness is just truly groundbreaking. It is through education that personal biases and societal stereotypes are collapsed and replaced with the truth. Having this evidence-based, unbiased understanding of mental illness will allow us to approach our patients with greater care, understanding, and kindness. It is so critical that our understanding of mental illness be founded in truth, and that we seek accurate, updated, and beneficial resources to help us navigate these often tricky encounters and relationships. Our patients deserve the best care we can offer, and this standard truly begins with education about mental illness and mental health. The final question asks, was this theory effective? Why or why not? And was the recommended theory both age and developmentally appropriate? I believe this theory was effective. Of course, taking it from paper to clinical practice is harder said than done. Still, I believe that the ideas presented in this theory and the key focuses of the deliberative nursing process translate to more dynamic, patient-centered, and improved care. The focal point of this theory is really listening to the patient and allowing their concerns and worries to dictate the worries and the focus of the healthcare team. The importance of assessing and validating patient concerns cannot be overstressed, as it is through practice that true patient-centered care can be provided. I believe this theory is both age and developmentally appropriate. The key points discussed above are fairly universal and could be applied to most nurse-patient interactions regardless of that patient's age or developmental stage. This is another reason that I believe the deliberative nursing process theory would be successful if applied to the schizophrenic man kind of depicted throughout the video. That's all I have. Thanks.